Another area of interest in colon cancer is that there are a lot of trials going on with immunotherapy plus chemotherapy or plus TKI to try to convert those MSS tumor sort of the cold tumors to hot tumors. And one of the trial that was presented to ASCO was a combination of Regorafenib plus Pembrolizumab. Now, this combination of TKI IO in MSS tumor has gauged a lot of interest since a couple of years ago when the group from Japan presented data with Nivo plus Rego showing response rate of 30% in Japanese group population. Now, that was published in JCO, but since then, really there has been a lot of attempt to duplicate that same efficacy, including the Rego-Nivo combination that was presented 2 years ago at ESMO and last year at ASCO as well in U.S. population, where unfortunately the Rego-Nivo combination only had a response of less than 10%. And this year, there's another data from US using that Pembro, once again, different checkpoint inhibitor, plus Rego, once again, is showing really not so promising response rate. On the other hand, there's a LEAP data that used the Pembro and Lenvima showing response with 20%. Once again, when Lenvima and Rego, they're TKIs, they're different, right? They're sort of different. They block a little bit different pathway, but yet TKI blocking multi different pathway. And the whole concept of combining TKI is that it could potentially change the microenvironment to make the immunotherapy respond better. But that trial showed response rate of 20%. So this data is sort of all over the map, but generally speaking, I would say, we need to find a better biomarker to predict who will respond to the combination. There's some data that the patient with non-liver mets tends to respond. That interesting enough, this year, the Pembro and Rego data show that if you got prior radiation, then maybe a biomarker that could show who will respond better to combination. But it's unclear at this time which will respond. Now, I think once and for all, the question may be settled with the phase 3 study combining using Lenvima plus Pembrolizumab. That trial is ongoing right now in the third line setting. I think that question will settle once and for all if that combination has any role in refractory setting. But I would say that based on the data right now, it's very modest at best. And I think but there are definitely some portion of patients that do benefit. Question is to figuring out which of those patients are, and I think that will be our future job to find out those potential maybe 5 to 10% patients that may benefit from this combination.